Today I'd like to demonstrate a gemstone therapy technique called Malachite Poultice therapy. The technique itself is very simple, but what's very interesting is that there's a way to measure how well it's working. I'll be demonstrating the intuitive test, although it can be modified for muscle testing. The test identifies how well the body is responding to the gemstones therapy. It also measures an action that's characteristic to therapeutic quality malachite. This action is called floating and sinking. When you place malachite as a poultice on the body, it has both a sinking action and a floating action that alternate. When an area is healthy, this alternating action will occur rhythmically. Okay, so let's first identify a relatively healthy area of the body. Okay, I'm just going to work with his bicep, and I'm going to begin by asking permission of that area. And I'm doing that inwardly. I can tell you what I'm saying. I'm just approaching the intelligence center of the bicep, asking if we can tune into its lateral flows. And the lateral flows are those flows that naturally, in a healthy body or area, move toward it and away from it, almost like breathing. When the energies come toward the body, they bring in life-giving energy, healing energy. When the energies move away from the body, it's like an exhale. They're removing spent, unwanted, used-up energy. So every part of the body is involved or should be involved in that lateral flow. Okay, so just tuning into the bicep and asking permission. And I know I get the permission when I sense my body engages with his, and I can tune into that flow. So here it is. It's moving toward and away. And there it is. Now, just out of curiosity, let's bring in the malachite, and I'm going to be placing the malachite in a spiral, like that, over his bicep. Fixing it a little bit. I know you can't see it, but it's right there. And let's see what happens. You can also turn your hand back and forth if you want to also. I'm not sure how well you can see this, but what I'm sensing is that I'm moving deeper into the body with my hand. It's going beyond the surface of the body. Before we had the malachite on, the movement was up here. He wasn't physically engaged with it. With the malachite on there, it is engaged with the physical part of his body. So that was kind of interesting because I just kind of guessed. He uses his arms a lot. I just kind of guessed that the bicep would be in good shape. And it was. It did have a movement, but it wasn't quite connected with the body. Let's take the malachite away and see if that's maintained. And yes, it has. It has been maintained. Awesome. So what that means is that his bicep is going to be more connected with the energies that are around it and available to it. I would guess that the arm would maybe be able to work harder and get less tired. All right, so here's a circle-in technique to find an area of the body that may be of concern. This is one way to do it. You can just circle in, and the body will tell you. Okay, it's circled into right here. Okay, so I'm just going to ask permission of this area. And it looks like it does have that motion, but look how relatively short it is. Okay. Placing the malachite. Okay. Honoring the intelligence center of the area, asking permission. Okay. There we go. So notice that the rhythm has slowed down a little bit. And from my end, I don't know if you can see this, but it's becoming more graceful. It's getting smoother. The transition is less choppy. See how the apex, it's smoother, and the nadir, the lowest point of the flow, the turnaround point, is also smoother. And you can notice the extension of this flow is also getting longer. I step away from the area so that I can see how the energy flows are moving deeper into the core of the body. And what happens when it gets so deep, it reaches the very center of the physical, what happens is that it's as though it reaches another orbital and it accesses the superphysical, the inner bodies. This flow does. It's really remarkable. And you can tell how deeply into the inner bodies or the inner dimensions that the flow accesses by how high up into the aura the flow is moving or reaching. And this is one of the principles of gemstone therapy. It's the body-centered model versus the soul-centered model. And you should be able to find that article on my website. There we go. That's improving. So what's happened here is that it seemed like the flow stopped moving. And it's not necessarily that they have, it's just that they have accessed an area of blockage. So very simply what you do is you just jiggle the gemstones that are on the body. Just give them a little jiggle. And the properties of the malachite, the detoxifying properties of it, will help release those blockages. And there we go. Looks like there's some more. There's more. Because see how much shorter the motion has gotten? So let's just jiggle those a little more. I'm going to jiggle them a little harder this time. Okay. Oh, that's a little better. There are other tools in my toolbox that I could use. For example, we could bring in some energy clearing spray. And you can see right away the flows have cleared up. But if you're just working with yourself or with a client and that's all you have is the Malachite Sunstone itself, just jiggle them. And that will help loosen up the blockage, get those energy flows moving again. Okay. Another thing that can happen is that, especially when you reach the nadir, suddenly it feels like everything gets quiet. It's not so much a blockage, it feels different than that. But everything gets quiet, and what's happening is that the body is moving deeper. It's of its own, in its own way, working to release the stuckness. And you can almost feel that there's a very slight, almost like a massaging motion. It's like a micro unwinding sense. It feels distinctly different than a blockage. And what it means is that the gemstone energies are working directly with that blockage, but in a different kind of way. I like to end this particular technique when the floating and sinking motion is active. Otherwise, if you stop when the gemstones have reached a blockage, then the processing will continue after the gemstones are removed. Then the processing doesn't get the gemstone support and the client can feel a bit dreamy. And at the end of the session, we want to make sure that the client is fully integrated and fully present in the moment. So I'm making sure we have nice movement of energies, and indeed we do. And I can remove the necklace. My name is Isabel Morton. I'm the founder of the Gemstone Therapy Institute. I'd like to thank you for your interest in gemstone therapy. And may I wish you all the best on your journey to greater health.